So, for our last part of my health insurance topic, I wanted to briefly talk about the Affordable Care Act. So, the big question is, what is it? So, Affordable Care Act had three primary goals when it was created. It wanted to make affordable health insurance available to more people. It expanded the Medicaid program to cover all adults with income below 138% of the federal poverty level. Supports medical care delivery methods to design a lower cost for healthcare in general. One of the biggest things for Affordable Care Act was to help eliminate a lot of issues that other healthcare services were doing, such as eliminating people for chronic care, for that had chronic health issues. But first, let's look at who is eligible. So I got a table that has the household number size, what your minimum level, and then the highest level of what you would make yearly to see if you would qualify. So if an individual had a family size of 4, then you'd be looking over seeing if you are in between the 26,000 and the 104,000 to see if you would be qualified. If you had a household more than 8 families, you would have to add $4,400 and $480 to each individual person that you'd be adding to your household size. If you're eligible for premium reduction when you fall between these lines. So important things that the Affordable Care Act did was changing those dependent age. So having coverage for adult children until the age of 26. So no longer when you turn 18, you've got to figure out what you can do now to make sure that you're taken care of if you can afford that with your job employment. Coverage. It no longer, insurance companies were no longer able to discriminate individuals based on their healthcare status factors. So some of these factors could be medical condition, could be claims experience, could be receipt of healthcare, medical history, genetic information, evidence of insurability, requiring insurance plans to cover people with pre-existing health conditions, including pregnancy, without charging people more. Insurance can't refuse coverage based on gender or pre-existing condition as well. Costs. So big thing with it, it held insurance companies accountable for their rate increases. It also made where preventive care was provided at no charge to individuals with their plan. Also, it helped decrease the cost of drugs. So each year, medications are being added to the generic name list in order to reduce that cost. An example in medications wise is enrofloxacin is the generic name for Baytril. And so Baytril is extremely expensive, and enrofloxacin helps making that generic name cuts that cost some as well. Such as Benadryl is a trade name. It is the generic of Benadryl is diphenhydramine. That is also how they put that with the generic name to reduce costs as well. No time limits. So those with chronic illnesses no longer have a set amount that a company will pay for them anymore. This greatly helps those who have diabetes, or they are in renal or acute or chronic renal damage. So it helps a lot of these others individuals as well. Another thing cost-wise, it helped with this was that women no longer are having to pay more than men because of delivery and the potential of having their pregnancy charged to that insurance company as well.